You know, I almost didn't do a PowerPoint. Boy, am I glad I did. I'd have felt really bad if I was the only one that didn't do a PowerPoint. Now, I am a nurse practitioner, but today I'm going to wear my legislator hat because I did know that these ladies were going to talk about a lot of science to you, and there's a lot of legislators in the room. And are some of you going like, well, this has been really interesting, but I'm not sure I know what to do with it? So that's, you know, kind of the challenge we face sometimes. That's kind of what I was thinking about. So I'm going to put my legislator hat on. And on one hand, you know, you can say, well, government really doesn't have anything to do with this. We've got, you know, we're having the whole health care reform debate and that sort of thing. And beyond that, government doesn't have anything to do with it. And on the other hand, some of you are probably going, wow, I didn't have any idea we could mandate something like this. I'm in, you know. So we've got a real variety of ways we could look at this. I might not be pushing the right button. Well, that clearly wasn't the right button. I apologize. I guess I should have deferred to you for showing me. Oh, there it is. That one? Okay. Well, this is why I think it's important to all of us. As some of the other speakers have talked about, women's health affects everyone. We're moms, we're grandmothers, we're providers of care either formally or informally, and we might be doctors and scientists and legislators as well. So women's health affects everyone. Now, in full disclosure, I have to tell you, those are my two beautiful grandchildren. So that was Halloween, obviously. They don't dress like that every day. I did push that right one. They don't let me do this often. Okay. That's right here. Okay. All right. So here are some of the things that are kind of obvious legislative challenges, I think. First of all, healthcare policy is kind of challenging and can be intimidating. When, you know, people always say, you're the nurse, you understand this, you do it. You take care of it. And I know there's other legislators with healthcare backgrounds, and you, by default, kind of get the issues. So a lot of people do find it intimidating. Secondly, you know, when we talk about policy, we think it should be pretty broad. It shouldn't be just focusing on one group of people. So a lot of times we get kind of squeamish when we're talking about women's health and thinking that is it any more important than men's health or children's health? Well, for obvious reasons, with the research, we know that there wasn't much research done on women's health until relatively recently. So it is important that we look at that. And additionally, just for the very same reason that we talked about why women are important in the lives, we need to focus on women's health as much as men. But we get a little nervous about that sometimes. Talking about sexual issues are sort of taboo sometimes. I don't think people said Viagra out loud for a long, long time. It may have been approved in 6 months, or 6 weeks, I guess it was. But I can tell you we mostly called it the little blue pill. So talking about female orgasms or dysfunctions is going to be something that's not brought up very quickly on House floors or Senate floors, I'm pretty sure. So we're going to have to overcome that. There's often conflicting information, and we just talked about that. When you get information coming out talking about, well, maybe we don't need to do those breast exams, maybe we don't need those mammograms, then you've got conflicting information out there, and people are going, who do we believe? What do we do? And then finally, as a legislator, what we know, first and foremost, there is no money. So we're going to turn those challenges into opportunities, and I think we can. We can find ways to simplify issues, simplify the language we use, so we're not talking in acronyms all the time, and we're not using real, you know, scientific terms about everything. We can put it out clearly and simply and relate it to the policy, and people will understand it much more readily. We can also agree that women's health issues are no more important than anybody's health issues, but they are equally important to everyone else's health issues and give them the attention that they are due. Gynecological disorders should not be ignored because people that are uncomfortable talking about them. We should find ways to talk about those disorders, and so that we can deal with them just as we do any other health issue. Now remember, I don't know how many of your states have mental health parity bills. that you've passed and what kind of mandates you have in your state. But if you've got a mental health parity bill that says that it covers everything in the DSM-IV, you're already paying for this, so there's no reason not to benefit from having good diagnosis and good therapies out there. And additionally, certainly depending on how the federal health care reform bill does or does not pass, that would be another thing that would mandate that you're covering these disorders, so you may as well do it appropriately. So innovations and addressing these issues, it becomes very important. And then again, focusing on the science, the research, and I'm guessing that you folks are doing some research and innovation in this field, and that's what we're here to talk about today. And support doesn't have to mean money. It can be simply doing the things that you're already paying for, that you're already doing, that you're already discussing, but creating some focus and creating some dialogue that just raises awareness. Education was an issue. One of the speakers, maybe all of the speakers, talked about. We have great opportunities to do education. Public health is going to need to weigh in and make some comments on the direction that women need to go for breast exams and that sort of thing now that there's this sort of controversy out there over what's right. So we have opportunities for different departments that were, again, already exist, already doing things in public health, our Department of Human Services. They can help with that education piece. We can also ask our universities to get involved with research opportunities, perhaps grant opportunities that exist out in the research world. It's interesting when you direct your universities to have some focus on some issues, they usually step up and do that because they really like to do at least some of the things that legislators ask them to do, because frequently they're doing things we're not very excited about. So it's a good opportunity for them to work with us. And I remember, Newt Gingrich always says, when you want somebody to do something, create a prize for it. Create a prize for innovation. It doesn't have to be a great big thing. It can always be. It could be a trophy, something that's nice to display in somebody's in a university's trophy cabinet or in a business's offices. If you create some kind of award for innovation, you will spur a lot of interest and a lot of creativity in how you might get some of these issues accomplished. And then I think the biggest thing the government can always do is just simply get out of the way. If we don't bog people down with rules and regulations and all the paperwork, 10 miles high, lots of things can get done. We just need to get out of the way. And so this is one of the things that I always go back to when I'm trying to make decisions about what things we should do, how we should support things. Just as government doesn't create jobs, businesses do. Neither does government create markets or innovation or any of those kinds of things. Consumers do, and when it comes to innovations, researchers do. So I'm just going to close with that and welcome your questions.